Okay, good morning, and you're very welcome to the Daisy Hill Medical Department. I'm John Harty. I'm the Education Supervisor and Foundation Programme Director. I'm on annual leave at the moment, and that's why I'm making this video, to give you a brief introduction as part of your induction. I'll be back on the 8th of August. So it's really just to inform you about my role with you over the next 6 months. We have prepared a specialty induction pack for you. This will have been emailed to you before you start. It contains lots of very useful information. A lot of it has been written by existing F2s and CT doctors about how to survive in posts, and it also contains in each section what your supervising consultant will want from you, and will give you the top tips as to how best to survive in that posting. This booklet will also reveal who your clinical supervisors will be for the duration of your 6 months. I will be your educational supervisor, and you will be scheduled to meet with me the second and third week into your posting. This will be to get you orientated with respect to your e-portfolio and to set your objectives for the next 6 months. We have an active teaching programme. Effectively, there's teaching almost every day. Most of the teaching takes place in Committee Room 1. Alternative Wednesdays, there's a large postgraduate meeting which takes place over in the boardroom, and there's usually a curry provided. Monday's teaching takes the form of the X-ray meeting. Tuesday and Thursday teaching sessions are more specific to medical department, and you'll be within the induction booklet that you have been sent. You will be allocated to present at one of the Tuesday or Thursday meetings. The teaching sessions take the form of journal club, grand rounds, outpatient classics, general medical core, and simulation. In the induction booklet you have been sent, there are clear guidance as to what each of those areas are. You're expected to plan in advance, link with your consultant, and obviously if your teaching session conflicts with leave or on call, make your own arrangements to swap those sessions. We do take an attendance record, and we are very enthusiastic about the trainees helping to lead and deliver the teaching. With regard to other educational aspects, there are clear guidelines on trust protocols. The main protocols that we like to focus on in medicine are the septic shock protocol, the acute kidney injury protocol, and the non-invasive ventilation protocol. And they are all at the back of your specialty induction booklet to look at before you pitch up for work. A few other things to keep you right. We have a formal handover meeting every Friday at 1:45 in Committee Room 1. The entire department hands over all the cases for the weekend, and it is at that meeting that we highlight patients who are particularly sick. We highlight patients who need both a senior and a junior review, and we highlight patients who need either blood tests or who have a ceiling of care. It is vitally important that all members of staff attend that meeting, and it is to be attended promptly at 1:45. On Monday morning at 9:15, there is the reciprocal of that, a take-back meeting, and that takes place in level 6. Again, mandatory attendance and prompt attendance at 9:15, and the weekend teams will hand back to you the cases that have arisen over the weekend. So those are two extremely important meetings to attend. They're both functional in terms of your clinical skills, but they're also an educational experience as well. In order to help coordinate our patients and our teams, we use an electronic system called Note, and you will be given passwords and instruction on how to use that. Note is extremely important. It's important for two aspects of patient care. Number one, it will identify where your patients are, which patients are allocated to your team, and more importantly, especially for weekends and bank holidays, you're able to find the tasks and the junior and senior reviews from Note. So please engage with Note and use it. It also acts as a conduit through to the electronic discharge record. The other really important aspect of Note is in terms of mortality. We have a monthly mortality and morbidity meeting, and the dates of those meetings are in your specialty induction book. It is also extremely important for both your professional development and for our own governance that you attend those meetings and contribute to those meetings. You will all have a major role in registering the death of patients who pass away in the hospital ward, and we will put in a screenshot to show you how to do this. When you are called to certify a death, you must obviously fill in the death certification record. We also ask you to make an entry in note. You call up the patient's record in note, you tick the box deceased, and as the screenshot shows, you then put what you have placed in the death certification record into note. This then creates a mortality record for the patient, and the senior members of staff will then come along and populate that record with additional clinical information for discussion at the M&M meeting. So it's really important that you engage with note, you engage with M&M meetings, and you engage with the whole process. Finally, I'd like to mention sick leave. Sick leave, everyone gets ill, but we often find that sick leave can reflect stresses and strains both from an individual and within the system. We take sick leave very seriously, and there is a clear policy at the back of your induction booklet that we would like you to read. If you are unable to attend work, you must notify Dr. Moan and Donna Muckin, and you must notify your clinical consultant. We would ask that part of this notification be done by email, so there is a tangible record in terms of your absence. We would also ask that on return to work there will be a return to work meeting, just to make sure that there are no unresolved issues and that you are fit to return. So we take sick leave very seriously, and we would like you to comply with the policy. So finally, I look forward to seeing you all when I get back from my holiday. I apologise if this video quality is poor. I have to do this all at one rush. I can't split it up and re-edit it. I really do welcome you to the department. It's a vibrant department. It's a hospital where it's a community hospital. Most of us either use it or our families use it. We are proud of this hospital, and we are proud of the training opportunities that it affords to you. We are here to support you and look after you in your training program, and we really do hope that you enjoy yourself with us over the next 6 months. Take care, and I'll see you soon.